All right, getting your quad function back after an ACL surgery, sometimes even after a total knee surgery, can be very difficult at times. Having that surgery, the swelling and the intensity of the surgery essentially shuts off that quad muscle. It's very difficult to activate the quad. I'll go through a couple here today and kind of give you an idea of what we would do. We'll start with some easy ones you may have seen, may not have seen. Let's just try some. It's important to get that quad going right off the bat. You need to have the quad firing so that you can obviously support yourself and walk normal. So the first one would be to try to push the knee down into the table. Okay. Sometimes you can use even a little bit of a tactile towel or something soft to try to feel like you're pushing down into. So that'd be one here where we go, just push straight down and try to picture your kneecap, patella, pulling up towards you. So I know this thing is it's dead right now and it doesn't want to work. So try to picture yourself pulling this kneecap up your thigh towards your hip. Pull it up. Also think about your tibia, your shin bone, kind of going down and kind of out like that, kind of like a J or a U, like it's going to scoop down. So when you push down, that shin bone kind of comes like this. Picture it, hold it tight. Now initially just getting an initial contraction is hard sometimes, but those are some visual cues. You have to reconnect that mind-muscle connection once it's been shut off from the surgery. So pull that kneecap up towards you and push that tibia down. Tight. Pull it up. All right? There's one like that. I would work on those to start with. That's a very easy one. Okay, then sometimes we can take something a little bit bigger. When we got that one, maybe a little bit taller, a small ball, or this is a half foam, where we want to place it underneath the knee. And now, since this does not smash, it's firm, I'm trying to pick the toe up. I'm still picturing my kneecap pulling up, and I want to pick that toe up in the air and tighten that way. This would be what we call a short arc quad. We pull up here and up. Okay? That's one. That's number two. Another one that can work that is a little bit different than those easy ones there is side lie. Okay? So I can use this muscle, right? My hip, because this is still working. This one's not. So pick it up sideways, then roll backwards slowly until your knee feels like it's going to give way and fall because you have no quad, and hold it right there. So just go, lift up, come back, roll back until your toes up, and you can try to kick that quad in so that your foot doesn't fall. Now you may only get a little bit here before it wants to fall, but then that's how you learn to kick that thing back in. Eventually we want to get all the way, back so we can do a straight leg raise. But maybe we start this way, come up, and slowly roll back, okay? Until it feels like it's going to fall. Right there, hold it. Maybe you can come back a little bit. Come back a little further. Hold it. Don't let it fall down, okay? Or you went too far. Another one we could do is, because the quad, here we go, we'll raise up a little bit. The quadricep is a two-joint muscle. It crosses the knee and helps the knee extend, but it also crosses the hip joint. It helps your hip flex. So if we can't get it to do this yet, if we can't get it to kick out straight, let's use it in a hip flexion. Let's use it to do this. Start here. Just lift the knee up. See, my knee is bent. I can't kick it straight, but I can use my quad as a hip flexor. Okay? Here. So start there, and then we're going to progress to, with the foot a little bit straighter, progress to there. Okay? And then out here, then we'll progress, later to the full one, but start with the knee, with the foot down, and just pull up and use hip flexion. Okay? Okay? Even if we have to do that, maybe even, side lying and just work on pulling that hip this way, because your quad muscle is a hip flexor. So pull up, okay, and back. Pull up. So you could do these two kind of together. You could do this one where you come here, let that fall back, let your body fall away to your backside. So your quad is up. Okay? So there's that one. Hold it, and then back here, and then work on flexing the hip forward. Use that quad. Okay, those are a couple of tips to get the quad muscle backfiring again after an ACL reconstruction, and possibly even after a total knee.